I'd like to begin by just saying how shocking it is that it's 50 years since the Equal Pay Act, and we're still here today campaigning on equal pay or seeking to get it. Before the Equal Pay Act came into force, women could legally be paid a different rate to men. Indeed, they could be paid a woman's rate. That was perfectly legal. But I'd like to mention to you today an exception to this, and one that's very close to my heart, and it's my mother. My mother, 60, 70 years ago, got equal pay. So how did that come about, and what can we learn from it? My mother was an Irish immigrant. She worked for Birmingham City Transport as a conductor and received equal pay. It was a tough job, but she also had to bring up a child on her own. And she knew that the pay that the average woman, low-skilled worker got was very low. Why did she get the same pay as her male colleagues? The rate was determined through collective bargaining by the Transport and General Workers Union, part of Diana's work union, the Unite Union. Well, was the union ahead of its time? Were they really pro-women? No, not at all. They were defending men. They were defending the men's wage, which began when women started to work on the buses in the war. And the men were concerned that the women would take the men's jobs if they were paid a lower rate, because the employer would prefer to pay a lower rate than a higher rate. So they ensured that women got the same rate as men. Now that's really important. It was important for women who worked on the buses. It was also very important for the Caribbean workers and the South Asian workers who were recruited to work on the buses. They too got the same pay as their white male colleagues. And a few years later, my mother was approached by a union representative to ask her to join the pension scheme, which she did after serious thought, because of course she had to contribute. And it prevented her being part of the massive group of women who experience a pensions pay gap. It's some 39%, a higher rate than the European average. 39% pensions pay gap. It's no wonder that many women find themselves in poverty in old age. So what can we learn from my mother's experience? Well, the first thing, of course, is that she worked in a male-dominated area. And we know when in male-dominated areas, women get paid more. And we've seen this illustrated so many times that when women are separated from men, their pay is reduced. The most famous case, of course, was the Ford sewing machinists, who were considered less skilled than their male assembly line workers. These women went on strike in order to challenge their position on the pay grade. And of course, this became a very famous strike, which was attributed to ultimately leading to the Equal Pay Act, and of course is now a well-known film, as you no doubt know. The second point we can learn from my mother's experience is the role of unions. It was collective bargaining that ensured that men and women were paid the same after the war as well as during the war. And it ensured that the ethnicity pay gap in that occupation for that particular job was not there. So while the union's aim was to protect men's work, it also worked in women and migrants' interests. The problem, of course, is that women and men are often separated horizontally and vertically. They do different work. And we have seen that, and that was something that my mother knew. She worked in domestic service and catering when she came to this country first. And we know they are some of the lowest paid workers, and it's women's work. It's also the case that there's vertical segregation. Men dominate the hierarchies. So the cases that Wanda mentioned at the beginning are very relevant here. Men dominate the hierarchies and get the highest pay. It applies to my sector, the university sector, And as Wanda mentioned, in banking, it's particularly pronounced. We have to ask, how is this allowed to continue? We have laws that require equal pay for work of equal value, but cases can take years to resolve and have a huge personal and psychological impact on women brave enough to take those cases. The current laws are complicated and difficult to navigate without support. The valuing of work is difficult and has an inbuilt gender bias. We have only to look at the discourse on care workers. Care workers in Britain today are deemed unskilled. Yet what is quite clear is that they are undervalued. Their work is deemed as women's work and therefore worth less. COVID-19 has highlighted the valuable and skilled work that care workers undertake. And in this current pandemic, the inherent dangers of that work when proper health and safety requirements are ignored. This reminds us of the 1889 match girls who went on strike for an increase in pay and better conditions. They worked for Bryant and May in the East End of London, where Queen Mary is situated. Their work was so dangerous that they got what was known as phossy jaw. That was effectively the rotting away of the jawbone due to the phosphorus use in the work process. Defenders of the legacy of the matchworkers' struggle continues today with the campaign to prevent the mounding over of the graves of one of the leaders, Sarah Chapman. Today, work should not be dangerous. Since 1974, we've had the Health and Safety at Work Act. And yet we know in the current pandemic, it is not being adhered to at all. There's a serious disregard for the dangers in women's work. Now, we do have some policies that work to make pay more transparent, but they've not worked effectively. So I'd like to finish, because I've got my 1 minute warning, on the challenges. What do we need to do? Well, we need a means to remove pay secrecy. It's absolutely essential. Pay is not secret in Norway, and it is a more equal society. We need to remove the requirement to give your current salary in new applications to avoid a reproduction of the unfair pay gap. It works in some US states. Why not here? We need to simplify equal pay legislation and bring back the pay questionnaire removed by the current government. Equal pay benefits society, not just women. So we need to ensure we don't get another public sector pay freeze, which will disproportionately affect women. And we need to ensure that we don't just clap for key care workers, but we need to pay them better. And that's in the climate of the being affected by immigration laws. And quickly, the government did an about turn on the requirement for international workers to reduce their contribution to the NHS. So more needs to be done. Thank you very much.